How is it that the wealthiest country in the world has such a screwed up healthcare system? After 35 years in the healthcare industry, I decided to retire and share my secrets with you. I'm Chuck Melendi, and this is Disruptive Dialogue. Hello, Disruptors. Chuck Melendi with Disruptive Dialogue. Hope everyone's doing well today. Very fortunate. I've got as my guest today Dr. Andrew Weinstein, who is a dermatologist in Boynton Beach, Florida. Dr. Weinstein's held numerous leadership positions in his profession, such as past president of the Florida Academy of Dermatology, past president of the American Society for Mohs Surgery, past chair, American Academy of Dermatology Advisory Board, and he's the incoming president of the American Academy of Dermatology starting this coming January 2026. Today's episode is going to touch on a topic that is not very publicized, but is having an enormous impact on healthcare in our country. Many of us often feel like physicians don't spend as much time with us as they used to. Sometimes it takes weeks, maybe months to get an appointment to see a doc. We hear in the news about the looming shortage of physicians in our country and that many physicians and healthcare practitioners are burning out. I even hear docs tell me that they tell their kids, don't go into medicine, go into something else. And what are we seeing today is that doctors, because of this environment, are slowly moving away from private practice, citing significant financial and regulatory changes that make it difficult for them to stay independent. In 2024, just last year, 42% of physicians worked in private practice. That is down from 60% in 2012. What does that translate to? 80,000 fewer physicians in private practice in just over the last 10 years. That means that more than half of physicians in our country work for some type of business entity, whether it be a hospital system, an insurance company, a private equity group. And while we can hope that patient care and the time spent with your doc won't be impacted, the reality is that many of these physicians are now going to be employees of large corporations. They're going to answer to business people, which increases the possibility that their ability to treat patients the way they want to might be impacted. My big question, and Dr. Weinstein is going to help us answer that today, is why is this happening? I mean, physicians don't go to medical school so they can work for somebody else. To begin with, we discussed multiple times on my podcast that the health insurance industry, the PBMs, they make life hell for doctors and their patients. They have to jump through all kinds of hoops and administrative gymnastics to get products and services approved, to get reimbursed for the services that they provide. And, one study that I was able to find 3 years ago showed that physicians' offices spend over $26 billion, that's with a B, handling all the paperwork and approval processes and trying to get reimbursed from insurers, and that's mandated on them. So when people tell me that, we want to go privatize and stay away from government because they're so much more efficient, that is usually true, but this is a strategy. They create all these hoops because if patients can't get the products they want, the services they want, then the insurance companies don't have to pay that off. If they delay physicians getting paid or try to pay them less, then that's more money for their shareholders. That is a huge problem. So what we're going to talk about is not the infrastructure of the healthcare system. We're going to talk about physician pay. And what you're going to find is that not only are the private payers paying our physicians less than they did last year or the year before, especially when you talk about inflation, but Medicare is paying our doctors less. And that is something that many of us are trying to fight and trying to help out. And Dr. Weinstein is going to talk to us today about what is going on with physician reimbursement, how have we gotten to this point, and where does he think it will end up if things don't change? Dr. Weinstein, thanks so much for joining us today.
Thanks, Chuck. Thanks for having me here. I just wanted to make one correction. So it is true that I've been elected president of the American Academy of Dermatology. My presidential term will start March of 2027. In March of 2026, I will assume office as president-elect of the American Academy of Dermatology.
Thanks so much. You're not the first person that's corrected me on this podcast.
Well, what I wanted to say is, I wanted to acknowledge what you said and to further say that I think almost everything that you mentioned can be connected directly with a straight line to Medicare reimbursement. And why do I say that? I say that because almost everything is related to this really arcane principle called the physician fee schedule. And the most important thing I can point out to you and to anybody who's listening and watching is that the physician fee schedule does not refer to what physicians are paid. No, it refers to what offices are reimbursed for the services that they provide to Medicare recipients. And as a derivative of that, it's what insurance companies pay. So it's this thing that was invented by Medicare in the 90s and was really perfected by Medicare in the late 90s. And it's what we all live with. So if I see a patient who has private insurance, that private insurance pays me on the physician fee schedule. They all use it. And by the way, to your point about who's more efficient, is it Medicare or is it private industry? I can tell you that in the state of Florida, we know that Medicare Advantage is an unbelievable business for the insurance companies. As a matter of fact, Humana has left the state for health insurance other than their Medicare Advantage. And guess what? Turns out that in the United States, Medicare Advantage, that is the Medicare replacement program, costs much more than traditional Medicare. As a matter of fact, Medicare, because of upcoding, because of favorable selection, cost $83 billion more than Medicare in 2024. That's just last year. And that's $2,500 more per enrollee. So they're inefficient. They also have been, it's been pointed out, there's been complaints and it's been investigated that their highly flawed system results in bonuses that waste another $28 billion. So we're talking about not millions, we're talking about billions. And if you were to just correct that, you could pay for what really doctors' offices need to stay open. So if the American public wants to continue to access private practice and come to an office like ours, where they get university level care, where they get referral level care down the street, we need to fix this broken physician fee schedule.
Yeah, Andy, thanks so much. I mean, the first time that we met outside of college, which years ago, we figured out that we went to school together, was you were talking about the physician fee schedule.
Yeah.
And I don't think people quite realize that, to your point, this system, it's codes that have reimbursement tied to it, whether it's for a knee surgery, whether it's for Mohs surgery, et cetera. To your point, that is revenue to the physician's practice, but that is not just covering the physician's compensation. It's his practice overhead, his staff, his nursing, et cetera. So, give everybody a taste of how the government has taken care of physicians in this country with paying you for the services that y'all perform since, let's say, the mid-90s. Are they keeping up with inflation? How's that going?
Well, they're not keeping up with inflation. They're at about half of what they should be. So let's just go back to 1992. In 1992, something called the Resource-Based Relative Value Scale was instituted for Medicare payments. And that replaced what was usual and customary charges. And that's how it used to be. Medicare and insurance companies would pay physicians' offices usual and customary charges. And the way that would happen is the doctor's office just decided what it needed to get paid to stay open. It was kind of like any business. And that really wasn't going to work because that was going to grow. So they had to figure out, how is it that we can figure out the resources that doctors' offices are using, anyone who's paid by the physician fee schedule, and let's just pay them for that. So they came up with RVUs, relative value units. And those are, through the years, they've tried to make that comparable. So we know the relative value unit of everything that every doctor does. So that way you can compare, say, a quadruple bypass to a knee replacement. You can compare what the pediatrician does to what the gerontologist does, all based on the resources that are required. And about half of that is the physician's time, and about half of that is what it costs to run an office. At least 50% is what it costs to run an office, including malpractice insurance, including all the supplies, employing all of those employees who are in the office. So half of the physician fee schedule, the RVU, is what it costs to run an office. Well, this was thought up by a very clever economist, and they said what it costs to do this today, and they perfected it in 1998, will not be the same as what it's going to be in 2 years or 10 years because there's inflation. So the government came up with something called the Medicare Economic Index, and it's what allows RVUs to be sensitive to inflation. That's their idea, Chuck. They came up with this idea. They said, we're going to multiply the RVUs times the conversion factor. And that conversion factor is there so you can incorporate the cost of inflation. Well,
and if it does that, that's a great idea.
Sure. And if for some reason it goes down, your cost of running an office goes down, then your reimbursement should go down. The conversion factor should be sensitive to inflation. Since 1998, the conversion factor was about $36 in 1998. It's about $35.50 today. It is less than it cost in 1998. So if we were to follow that forward, we know that inflation is up about 83%, and the conversion factor is down over 10% now. So really, the conversion factor should be double what it is today. And again, that's not my calculations. That's based on the government's numbers. If you were to just have applied inflation and not consumer price index, not my invention, the government's measure of office inflation, the conversion factor should be $70 today, and it's about $35 today. That's half of what it should be. And that is why people are experiencing longer wait times. That's why people are closing their offices, going to work for hospitals that don't necessarily have to abide by this. And that is made worse. It's worsened by this idea that Medicare Advantage is inefficient. So if the government could just adjust like they're supposed to do, then they would, but there's something called budget neutrality. Everybody other than physicians don't have to live with budget neutrality. So in order to fix this, Congress has to do something that hurts. They need to face what it would cost to fix this system. Now remember, this is a health insurance model. This is something that seniors have paid into. They deserve this. And now Congress is playing a dangerous game by not adjusting the conversion factor as they promised. And so what happens is some doctors are going to see more patients. Well, if they see more patients, they have less time for those patients. And we've all heard those complaints. They are going to get rid of their operators in their offices. So there's no one to answer the phone. And some people are going to see fewer patients, and that because they just can't afford the help that they need to see those patients. So they'll see fewer patients and the lines get worse. So doctors are burning out. They're either seeing more patients or they have less time. Some offices like mine have just closed. They just, one day they close their books and they say, my gosh, look, I spent more this month than I took in. I just can't do this. And, it really comes down to that really arcane physician fee schedule and the conversion factor, which Congress just has not had. They have not had the courage. They have not had the stick-to-itiveness. They have not done their jobs, and they have not made sure that conversion factor gets fixed.
Yeah, I appreciate that. I mean, that's such a great detailed explanation of what's happening, and I know that it is much more complicated than that, and I appreciate you simplifying it. But just so everybody has an idea, I mean, nobody would put up with a situation that your boss doesn't give you a raise at least every year, every other year, just to keep up with inflation. And Andy, as like you just said, y'all haven't gotten a bump to your conversion rate, which impacts the revenue that comes into your practices for over 20 years. I mean, almost 30 years.
I mean, my employees all deserve raises. They're all doing a yeoman's job.
Right.
How is it that a company, we're essentially a company, and we are supposed to receive payment for their services, and they deserve this increase. And in this time of crippling inflation. And the post-COVID period, the inflation was crippling. It was up to 10% in the office. And last year, so let's compare 2024 to 2025, they cut us 2.83%. By the way, just is this a financial problem or is this a political problem? Medicare Advantage, and as I mentioned, Medicare Advantage is highly pilloried for costing more than Medicare, for overcharges, for questionable. It's estimated that 6 to 7% of what is paid to Medicare Advantage is faulty, and we know that because of the way they do things, it just costs more. They got a 5-point-something% raise last year, and so this is really not a question of should doctors make more money. This is a question of should doctors' offices stay open? Because if you don't compete with the market for your employees, you can't stay open. And the only way you can compete is if the market is sensitive to the cost of doing business. Hey, Greg Murphy is a congressman from North Carolina. He's a physician, and he's famous for this metaphor, this analogy that he gives, where he says, if hammers cost you $1 to buy, you can't sell them for 50 cents. And that's essentially what is happening. And these offices are going to close, or they're going to cut corners.
Yeah. I mean, and we are seeing the impact of that right now. As we mentioned earlier, physicians, if they are getting paid less, unless they have to see more patients just to break even, people complain about that. It's not the doc's fault. It is what Medicare is doing. I'm a junkie when it comes to podcasts. There's a podcast called the Healthcare Breakdown Podcast. This is a 60-second one, a guy named Preston Alexander. And he was talking about the physician fee schedule. And he went to the Journal of American Cardiology College, and they had an article that showed the cost of a transplant. The median Medicare cost of a transplant is reimbursed to a hospital $216,000. When you looked at the CPT code for the surgeon who did that, it's $4,717. So of the $216,000, the doc who actually did the surgery, CPT code is $4,700.
Well, it's interesting because at the same time that we've had cut over cut, as I mentioned, since 1998, since the inception, we're actually down. But at the same time, hospitals, durable medical goods, nursing homes, skilled nursing facilities, they've all kept up with inflation because on the face of it, that makes sense. We are the only ones, and some would argue that Medicare is there to pay your doctors to do what you need them to do. And that's why you have hospitalists. That's why nobody is home at the doctor's office. That's why things are closing. That's why corporate America is forcing doctors to behave in a way that their patients do not like. And then some of us are just going to retire early. And you take the federal government is paid for us to be trained. When I was a resident, it was Medicare paid for it. And they're going to get very little out of this investment if the doctors cannot practice in a way that they're used to practicing. And that's what the physician fee schedule should guarantee. Now, I should reiterate, I already said this, that if you accept insurance, which almost everybody does, what you get reimbursed is a derivative of the physician fee schedule. So in some places in the Midwest, they get something above Medicare. In Florida, especially in South Florida, we get a percentage of Medicare that's less than 1. So we're actually hit harder by the insurance companies. They give us less than 100% of the Medicare rate. It's all linked to Medicare. So if we were to fix this physician fee schedule, we would fix insurance company problems as well. If you get paid 80% of Medicare, well, you're going to get paid 80% of a higher rate. And again, it approximates what it costs to deliver that service.
Yeah, and it's mind-boggling to me because when I stepped into the role of advocacy 10 years ago, and I was exposed to a lot of the issues that physicians are dealing with, I saw, to your point, the insurance companies every year get a bump. The hospitals every year get a bump. The only group that didn't get a bump every year was the docs. And I'm sorry, if you go in for a knee surgery, I want my orthopedic surgeon to be paid well to take care of that. If I go to have Mohs surgery, I want you getting paid well. We have come to the point where our government is providing funding for the institution of healthcare, but not those who are actually practicing the practice of medicine, which is what everybody wants. I'll tell you a really crazy thing. Before we got on this call today, I went to ChatGPT and I said, is the government trying to push people from traditional Medicare to Medicare Advantage? And ChatGPT, which scans the internet, says, yeah, there is evidence that the U.S. federal government has increasingly supported the growth of Medicare Advantage over traditional Medicare, both directly and indirectly, although officials may not describe it as pushing.
Yeah, well, they've said it. They've said, various, and this is from both Republican and Democratic administrations. They've said that they want all Medicare recipients to be in some sort of alternative payment model, which means not fee for service. And the most dominant one is Medicare Advantage. And I have to tell you that what they're doing, there's a lot of cynicism, and there's people who realize that if you destabilize the system, we're not going to a better place. We have the envy of the world here. Again, we have such high level medical care, and if you go to any one of these places where people talk about like Scandinavia or anywhere else, if you get sick in one of those countries and you have money or power, you come to this country. We're the envy of the world.
Yep.
But that's gonna go away if we can't stay in business. And I would put it this way. I do think that doctors deserve to get a raise with just like everybody else, because it costs more. It costs more this year than it did last year, and so forth and so on. But we're not even talking about that when we're talking about decreasing. When we're talking about the decreasing conversion factor, we're talking about them being able to keep their offices open. So doesn't it make sense that you should be able to give raises to your employees, and as your own health insurance skyrockets, as your rent skyrockets, as the insurance to cover your building skyrockets, and the government has put that into your payment. They haven't said, they don't let us compete based on how good we are. They say these are the resources. Those resources are all in the RVUs. Doesn't it make sense that they should have to cover it? We are so far below what has happened to the consumer price index and MEI that there's a crisis coming. But I agree with you, Chuck. I think you want the best and brightest to be doing your surgery, to be taking care of your children, to be taking care of your parents. And the cynicism with which the government, with which our House of Representatives, with our senators are treating this is absolutely reprehensible. They have no reason, though. Right now, there's no pressure on them because they're able to couch this in, doctors make enough money. Let's put that aside for now. It's not about doctors making enough money. Clearly, doctors' offices cannot stay open under this. And you know when they're going to do it, they're going to do something about it when it's too late. And once, think about the healthcare system like Jenga. Once you pull out too many pieces and it falls apart, yes, you can rebuild the tower, but it's going to take a long time and people are going to get hurt. Have you tried to get a primary doctor and they say, well, you have to join our concierge program? That's why this is happening, because those doctors cannot stay in business with what Medicare pays.
Or they say, we don't accept Medicare patients, or we don't accept any more patients. And, it's funny that you say the Jenga game, because that is like my logo. It's I've got it sitting right beside my laptop right now. But you've hit on so many points. One thing that you and I discussed earlier that I really appreciate is that people need to realize the government owes us to pay the physicians and the healthcare practitioners that care for us money, because we pay into Medicare our entire lives. I mean, the Medicare Trust Fund, I started working when I was 16 years old. I've been paying for almost, 40 something years. I want that money to be used appropriately, and I don't want them giving it to these multi-billion-dollar corporations that are upcoding, and every investigation by the FTC or the DOJ sees what they're doing. I want them paying my docs so that I can get cared for correctly. And people go, it's not an entitlement program. We've paid for it.
Yeah.
We deserve that.
Yeah. It's extremely cynical, because seniors now have paid for this, and the government particularly Congress, is not doing their job because they don't have the courage to do this on the left, right, or in the center. And if you just look at the lobbying apparatus for those other, whether it's durable medical goods, skilled nursing facilities, they have better lobbying apparatuses. I think that organized medicine has done a deplorable job, which is why we sit here. But I shouldn't even have to say that. Congress should stop being so cynical about this. They should stop using this as their piggy bank, which is exactly what they're doing. And by the way, they go, if you get sick, I sat next to the former Congressman Alcee Hastings on a plane. May he rest in peace. Representative Hastings was very ill when I was sitting next to him on the plane, but he wasn't worried because he had federal insurance, and he was going to go to one of the federal programs in Washington D.C. and he did get excellent care. Medicare recipients deserve that too, and Congress does not feel the pressure, and we should not have to apply the pressure. But I got to tell you something. We should be applying that pressure. So Congress should not feel free to cut Medicare because it will have downstream effects on the elderly. And I hope against hope. And I'll tell you something. As I mentioned, I become president of the American Academy of Dermatology in March of 2027. And I can assure you that apparatus, our political apparatus, is going to start to say what this is. And that is, these are Medicare cuts, and Congress should be ashamed of what they're doing, and they need to take care of their seniors. And the way you take care of the seniors is make sure that doctors' offices don't close, and make sure you don't funnel those Medicare dollars to irresponsible corporations who, to be honest, have a better lobbying apparatus.
Oh, absolutely. I mean, it is beyond the pale when you have these Medicare Advantage private insurers come out and say, do not let Congress cut Medicare. They're not Medicare. They're not traditional Medicare. They are private institutions answering to shareholders. There was a really interesting op-ed written in The Hill by former Representative Jim Greenwood in the last month. He basically came out and said, I helped create Medicare Advantage. Here's why I believe it needs to be reformed. It is morphed into an efficient private industry to manage medicine more effectively. Now you have business people that have figured out how to game the system, how to hide their profits, how to grow their revenue, and they wield incredible power up in DC to the detriment of all of us. And our physicians are going, they're going out of practice. We're going to be having longer lines to see physicians, or you go to the hospital where everything costs more. It's a spiral.
Well, think about this for a second. So let's just be conservative about it. They cost at least $27 billion per year extra in risk payments. It's the number's probably more due to the funny way that they do business. They're very lucrative to the insurance companies, but they spend less of the premium on patients in traditional Medicare. So instead of phasing out those bonuses, in 2023 they got an increase in those bonuses, and then this year they got, as we got our cut, they got 5+% more. So if you think about this, perhaps this fits the political philosophy of somebody, but really this is pushing us to a system that's inefficient and quite temporary for that matter. So Congress is aware of this. Incidentally, if you take that very conservative number of $27 billion per year in excess, if you deduct that from Medicare Advantage, you could fix the broken Medicare fee schedule. That's what it would cost to just apply an inflation-based, nothing crazy, an inflation-based adjustment as was expected, as was designed into Medicare. That's what it would cost. All you have to do is stop overpaying. You don't have to get rid of Medicare Advantage. Stop overpaying Medicare Advantage, and you could fix the physician fee schedule. Because I can promise you this, without insurance, people could still get well. Without doctors, they certainly can't get well.
Exactly. It's one of those things that blows my mind, and people just seem not to realize how much resources these large corporations are taking from us every day. They're causing inflation. They're causing employers to pay more for their employees. They have to raise the cost of their goods to cover that, just like you in a practice. I mean, it is unbelievable that we have allowed a handful of companies to, one of my second episode, there are 7 companies that make over $1.5 trillion every year in revenue. And they cry wolf every time that there's going to be cuts. And we have physicians having to go out of practice or go work for a hospital or go work for an insurance company because they can't keep the doors open.
Yeah, and Congress doesn't mind cutting Medicare. That's the bottom line. They do not mind cutting Medicare unless there's a threat to their electability. And that's what Medicare Advantage does. They convince the public that by somehow reining in Medicare Advantage, that is a Medicare cut. That's not a true Medicare cut. The cuts that physician offices, the cuts that your doctor has been having to endure and really having to cover, those are true Medicare cuts. And there's a point where they're going to just result in less adequate care. And every doctor's office has had to make that choice. So to me, this one's pretty easy. When you go to the Hill to talk about this, what they cleverly say is find the pay for. Well, there's plenty of pay fors. They know that. They know, but they do not want to go against the powerful insurance industry because of lobbying dollars, because of lobbying efforts, because of perception. They certainly don't want to go against PBMs, even though pharmacy benefit managers exist to drive up the price of medicine. And this is a political question. And I think that anybody who's listening needs to apply pressure to Congress and say, hey, stop cutting Medicare. My doctor's office deserves to stay open. And by the way, for those who think that it is somehow inappropriate for doctors to want to make an inflation-based adjustment to their own income, I'm not even advocating for that, but there's absolutely no hesitation on the part of the CEO of Humana, of any of the companies that provide Medicare Advantage to have such raises and bonuses, and they're based on their profits. And their profits are just based on upcoding and favorable selection, things that about them not competing financially with the federal government, maybe the most inefficient purveyor of healthcare in the world.
Yeah, no, it's really sad. I have an episode that I haven't released yet, and I'm going to do it in a couple months, but it is based on healthcare executive pay. And it goes across the entire industry, drug manufacturers, device, health insurance, you name it. They, on average, some of these biggest CEOs make around $24 million a year. Well, if you divide a work week of about 50 hours a week, that comes out to close to $10,000 an hour.
Yeah,
$10,000 an hour, Andy. That means that the average nurse in this country makes $94,000 a year. These guys are making more than a nurse in less than 2 weeks.
Yeah, and again, I have no problems with entrepreneurs getting paid what they deserve. I have no problem with an executive who smooths the system, who makes things work better, getting reimbursed for that. But that's not what's happening. They are clogging up the wheels of medicine, and I'm not here to say anyone does or does not deserve their bonus, but you can't say they do. I can tell you that doctors every single day are working to make their patients better. When it doesn't work out, it's not that they're not working to make their patients better; it's that the system is stacked against them. If you're an internist and you have 50 more patients to see because you get paid half of what you did 20 years ago, it's half controlling for inflation. Controlling for inflation, it's half. It's less. It is less than we were paid the year I graduated from medical school. With that said, so you yes, you're getting paid half of it, but you're actually getting paid less in dollars. So it's not just controlling for inflation. You're getting paid less today in $2025 than they did in 1998 when the dollar bought a whole lot more. So you tell me that doesn't seem to work. And I know this. I know that when I was in medical school, the best and the brightest went to medical school. That's going to stop happening. Because this, you really want the best people. And, I don't think anyone needs to be a millionaire, but I think that they do need to be reimbursed for what they're doing to keep their offices open.
Yeah, I mean, look, there is no look. We live in a capitalist society. We want people to be paid for what they're worth. Mm-hmm. And look, I go after these executives. Look, these executives, I come from that world. These guys are not entrepreneurs. They did not invent anything. They did not create anything. Most of them just climbed the corporate ladder, and this is what they get paid. But why are you getting raises and you're getting paid when you are running a healthcare system that is going to hell in a handbasket, that people are not being treated as well, that when you compare a lot of our healthcare to other countries, is especially on access and affordability, we are less. And lastly, and it blows my mind, people's like, well, you know what? They're successful companies. No, their board of directors have created their pay package where over 70% of their pay is based on stock. And so what do they do when the stock isn't doing well? They take their profits and they buy back stock to drive up the price to increase their compensation. They don't lower our premiums. They don't give the money to physicians who actually practice medicine and take care of us on the front lines. It is such a warped system that needs to be reined in.
I mean, it's clearly a government payout. So if you cost more than Medicare, yet somehow Congress is in love with you, well, I would say that there's something nefarious at work here. And that's what's happening. They are funneling extra dollars to the tune of billions, whether is it 27 or is it 83 billion? I don't know. It's somewhere in there, but it's a lot of money. That is not a rounding error. And so those who are talking about this being private, and it's not private industry, it's just a government payout. And they're very good at getting that. And Congress is going to get its comeuppance once the public starts realizing this, that they're taking those Medicare dollars. And by the way, I see patients every day. The cost of drugs, the cost of having Medicare Advantage is making them poor. By the way, Medicare Advantage actually ends up costing patients more in the multiple copays and the high copays that they have to pay. So not only does it drive up Part B for everybody else because of their upcoding and favorable selection, it makes B a worse pool. It actually is more expensive for the recipient of the Medicare Advantage. So, again, this is just a government payout, and I think that hopefully we are able to provide the type of research that points out this question. We're able to show that what Congress is doing and how frankly irresponsible it is. My hope is that we can fix this physician fee schedule, because if we don't, we're headed for a multi-tiered system. The month that I pay out more than I bring in, I'm going to have to start charging cash. I'm not going to be able to accept insurance, and people are going to have to start paying me. They've already paid for their health insurance, and we want to accept it. But if we can't, we can't. And I'm not unique in that. And so, I think we better really, I think Congress really needs to address this one issue. And it's very simple. It is attaching an inflation-based adjustment to the physician fee schedule, to the conversion factor, as they promised they would in 1998, as they envision this. This is the system they created. This is the system that they promised to seniors. And all we're saying is keep it.
Yeah. Well, I'll start to wrap this up because, you've hit the points of things I was going to ask you questions about, of where we're headed and what that looks like. And you've already said concierge medicine, closing doors, seeing less patients, becoming a multi-tier system where there's the haves and the have-nots even more than now. And I just find it sad that we have paid into the Medicare system. They are manipulating that. To your point, they treat it as their own little piggy bank. They are paying off these huge corporations. And at the end of the day, it's individuals like us who are going to be patients that are going to pay for it. And, I think all of our seniors, all of our people need to say to the media, say to our legislators, why are you cutting Medicare? And they are cutting Medicare every year because Medicare, at the end of the day, should reflect what they are paying physicians who actually take care of us, not these corporations, not all these administrators in the hospitals. And they have been cutting physician pay for over 25 years. and they've been lying to us, and it's disgusting. Anything you want to close in outside of that, Andy?
No, I agree with you. But listen, to maybe on an optimistic note,
Yes, please.
this is the very best time in the history of the world to be practicing medicine and to be a patient. In 2009, if you got a malignant melanoma and it were metastatic, you're very likely to die. Today, you're not likely to die. You're likely to be able to get an effective treatment. If you have an inflammatory disease, we know more about how that works. We know more about how cancer works, how heart disease works, how rheumatologic disease works. We're better at that. And so it's exciting. Yep. But on the other hand, if you don't enable the doctors who really understand that to practice our craft, then it becomes a disaster. And so we can do more today than ever. And it's a miracle. And the converse is true. How sad was it just in our lifetimes when a child would get a diagnosis of leukemia and that child would just die? Yep. We have such unbelievable tools. So I'm optimistic about this. I think that Congress needs to realize that they're playing with fire, that once this tower falls, it's going to take a while to improve. And this is part of the wonder of living in this country, that you can get this high level of care no matter where you are. So I'm optimistic because what I've seen in my career has been nothing short of remarkable. But if I'm out of business, it's not going to matter. So I hope that Congress realize that it's really this simple. You fix that conversion factor and we stabilize medicine. You don't, and we revert to a system that we won't recognize.
Yeah. Well, I'll tell you on that note, and I agree with you, this is an incredible time with incredible discoveries. I had a guest on my podcast early on with the Arthritis Foundation. Her child at the age of 2 was diagnosed with juvenile rheumatoid arthritis. And the physician told her, if it was 20 years ago, I'd say, you need to get a wheelchair. She's not going to walk again. She's on medicine and she's running around being a little kid. And so you're right. The promises are there. We have the best physicians in the world. We have to make sure that our government officials are taking care of the money that we have paid for over the lifetime of working, pay our physicians who are the ones who take care of us, and stop feeding these huge corporations. Andy, always a pleasure. Great to see you. Love the passion as always. Sometimes it's about healthcare. Sometimes it's about our Florida Gators. But either way, it's been a blessing to sit here and chat with you and catch up. And thanks for everything you do.
You're welcome, Chuck. Hey, talking about the best time to be alive, with a national championship in basketball, the Florida Gators, with an upcoming football season coming, it's always hopeful. So great to see you, and I promise to keep working hard for this.
That sounds great, and so do I. You take care of yourself, and I'll talk to you soon.
Right,
thank you.